For a lot of men, erectile dysfunction becomes a private battle fought in silence. A prescription can make the symptom less visible, but it does not answer the deeper question. Why did blood flow start failing in the first place? In modern cardiology, that question matters, because erectile dysfunction is often not an isolated reproductive issue. It can be an early vascular warning sign. The fourth Princeton consensus states that men with ED should be treated as being at risk for cardiac events until proven otherwise. If this has happened to you, I want to say something plainly. You are not broken, weak, or alone. ED is common, and it can feel deeply personal, but it is also a measurable sign that the vascular system may not be functioning normally. In many men, the real story is not, the body is just getting old. The real story is that the blood vessels are under stress. When the inner lining of the arteries begins to malfunction, erectile function is often one of the first places the problem becomes visible. This video is for educational purposes only. ED can be an early sign of severe cardiovascular disease or diabetes. Consult your physician or cardiologist before starting any new supplement protocol or ignoring prescribed medications. Men with diabetes commonly experience ED earlier, and ED can also appear before symptomatic heart disease, which is one reason clinicians take it seriously as a cardiometabolic warning sign. Here is the central idea. Erectile dysfunction is often the body's check engine light. The light does not mean the engine is finished. It means something inside the system is failing and needs attention now. In the same way, ED can be the first visible signal of a much larger vascular problem. Studies and consensus statements consistently show that ED may precede coronary artery disease, stroke, and other cardiovascular events by years. That timing matters, because it means the symptom can appear long before a major heart event forces the issue. Think about what that means. The penis is not separate from the cardiovascular system. It is part of it. So when erectile function changes, the body may be reporting a circulation problem, not just a performance problem. That is why many experts describe ED as a sentinel symptom of vascular disease. Smaller penile arteries may show the effects of plaque and endothelial dysfunction before larger coronary arteries do, because the same burden creates a bigger flow problem in a narrower vessel. And that is where the conversation has to become more honest. The question is not simply, how do we make the symptom go away tonight? The deeper question is, what is happening to the blood vessels that made this symptom appear in the first place? In the next section, I am going to show you the anatomy behind that warning sign and why the smallest arteries often fail first. Now let us go one level deeper. The body does not usually fail everywhere at the same speed. That is the entire logic behind the artery size hypothesis. Penile arteries are typically 1 to 2 millimeters in diameter, while coronary arteries are typically 3 to 4 millimeters. When plaque, inflammation, and endothelial dysfunction begin to narrow the vascular system, the smallest pipes show the problem first. That means erectile dysfunction can appear before angina, before a heart attack, and before many men realize they have a cardiovascular issue at all. This is why I call ED the body's check engine light. A dashboard warning does not always mean the engine has already failed. It means the system is under strain and needs attention now. In cardiovascular medicine, ED can function the same way. It is often a sentinel event that points to underlying vascular disease, especially when the cause is not neurological, hormonal, or medication-related. In multiple reviews, ED is described as an early marker of subclinical cardiovascular disease rather than a separate problem isolated to the genitals. The reason this matters is timing. The same vascular injury can affect different organs at different moments. The penile circulation is often affected earlier because the vessels are smaller and less forgiving. That is why ED may show up years before symptomatic coronary artery disease. Several reviews describe ED as preceding cardiovascular disease by a few years and serving as a window of opportunity for risk reduction. In other words, the symptom is not the enemy, it is the messenger. Now think about what plaque and vascular injury are doing mechanically. A small amount of narrowing that may be tolerated in a larger artery can create a much bigger flow problem in a smaller one. That is why the same burden of atherosclerosis can produce erectile dysfunction before it produces chest pain. The issue is not simply blockage. It is also endothelial dysfunction, the loss of normal vessel signaling that should allow blood flow to increase on demand. So the real question is not, why is the symptom here? The deeper question is, what is happening to the vascular system that created it? Once you see ED through that lens, the conversation changes completely. It is no longer just about performance. It becomes about circulation, endothelial health, and cardiovascular risk. And that brings us to the next layer of the story. The endothelium itself, the nitric oxide system, and why healthy blood vessels are the foundation of healthy erectile function. Now we get to the layer most men have never been taught about. The endothelium. This is the thin inner lining of every blood vessel, and it is not passive tissue. It helps regulate vascular tone, blood flow, clotting behavior, inflammation, and overall vessel flexibility. When it is healthy, it behaves like a highly intelligent interface between the bloodstream and the vessel wall. When it is damaged, the entire circulatory system becomes less efficient, less responsive, and more vulnerable to disease. Endothelial dysfunction is defined by a reduced capacity to produce nitric oxide and a reduced sensitivity to nitric oxide, which leaves the vessel wall more pro-inflammatory, more pro-thrombotic, and less compliant. Inside that endothelial layer, one of the most important signaling molecules is nitric oxide, or no nitric oxide is a powerful vasodilator and anti-inflammatory messenger that helps maintain vascular homeostasis. In simple terms, it tells the smooth muscle surrounding the artery to relax so the vessel can open and deliver more blood when the body needs it. That process is essential for erection, because erectile function depends on rapid, controlled vasodilation and strong cavernosal blood flow. When nitric oxide signaling falls, the vessel cannot relax properly, and erectile function begins to fail. The problem is that nitric oxide production does not fail in isolation. It is usually reduced by the same vascular stressors that damage the rest of the cardiovascular system. Oxidative stress, insulin resistance, diabetes, hyperglycemia, hypertension, and atherosclerotic injury all push the endothelium in the wrong direction. Research shows that insulin resistance is frequently associated with endothelial dysfunction, and oxidative stress can reduce nitric oxide bioavailability while promoting vascular injury. In men with diabetes, the pathophysiology of erectile dysfunction is often largely driven by endothelial dysfunction and impaired ability to maintain vasodilation and vascular homeostasis. This is why erectile dysfunction is so important clinically. The penis depends on a finely tuned vascular response, and that response is highly sensitive to endothelial health. When the endothelium cannot generate enough nitric oxide, the cavernosal smooth muscle does not relax as it should, blood flow is inadequate, and erection quality suffers. Studies have repeatedly linked erectile dysfunction and endothelial dysfunction through the same nitric oxide pathway, and both can act as longitudinal predictors of cardiovascular events. In other words, the symptom that shows up in the bedroom may be reflecting a process already underway in the coronary circulation. So the core lesson is this: erectile dysfunction is not just a local mechanical problem. It is often the visible result of a broader endothelial problem. The vessel wall has lost its ability to communicate, relax, and respond normally. That means the real target is not just the symptom, but the biology behind the symptom. Restoring nitric oxide signaling, reducing vascular stress, and protecting endothelial function before the disease progresses further. And that sets up the next question perfectly. If the biology of erection depends on nitric oxide, then what exactly are PDE5 inhibitors doing, and why do they help only temporarily? Now let us talk about the medications themselves with precision and respect. Drugs like sildenafil and tadalafil are PDE5 inhibitors. Their job is not to heal plaque, reverse atherosclerosis, or rebuild the endothelium. Their job is to block phosphodiesterase type 5, the enzyme that breaks down cGMP. By slowing cGMP breakdown, these medications amplify the normal nitric oxide signal and help the smooth muscle in the corpus cavernosum relax more effectively during sexual stimulation. That is why they can improve erections. They enhance the signal. They do not create a healthy vascular system from nothing. This is why these medications can be very effective, even in men with hypertension, diabetes, dyslipidemia, and other comorbidities. Large reviews note that PDE5 inhibitors improve erectile function across a wide range of causes and severities. That is important, because it explains why a man can feel better without actually knowing whether the underlying vascular disease has improved. Symptom relief and disease reversal are not the same thing. This is where the illusion begins. The medication makes the response easier, so it can feel as though the entire problem has been solved. But from a cardiometabolic standpoint, the blood vessel may still be inflamed, stiff, and dysfunctional. In practical terms, that means the pill can temporarily improve flow while the broader process of endothelial injury continues in the background. That is why relying only on the prescription, without addressing blood pressure, glucose control, inflammation, sleep, exercise, and vascular health, can leave the root cause untouched. This is an inference from the mechanism and from the broader cardiovascular literature, not a claim that the medication is useless. So when I say the medication is a band-aid, I mean something very specific. It can cover the symptom, but it does not remove the plaque, repair the endothelium, or restore nitric oxide production at the source. It can help a man function, and that matters. But if the vessel wall is still deteriorating, then the biological problem is still there. That distinction is clinically important, because the goal is not just an erection tonight. The goal is better vascular health over time. And that is the turning point. Once you understand how these medications work, you stop asking only, how do I force the vessel open? And start asking, how do I make the vessel healthier? That is the real conversation. Because true recovery is not only about pharmacology. It is about restoring the biology that creates natural blood flow in the first place. And that brings us to the final chapter. How to support endothelial repair, nitric oxide production, and long-term vascular function in a way that works with the body, not against it. Always consult your physician or cardiologist before changing any prescribed treatment or starting any supplement protocol. So now the conversation becomes practical. If erectile dysfunction is often a vascular warning sign, then the long-term strategy is not to chase the symptom alone. The strategy is to improve the health of the blood vessels that create the symptom in the first place. That means lowering inflammation, improving insulin sensitivity, protecting the endothelium, and restoring nitric oxide biology. Reviews of erectile dysfunction consistently point to lifestyle and nutrition as central factors influencing vascular nitric oxide production, endothelial function, and erectile health. This is where the fundamentals matter more than any single product. Physical activity supports erectile function by improving endothelial function, increasing nitric oxide synthase activity, reducing stress and anxiety, and improving metabolic health. Weight loss and exercise can improve insulin sensitivity and vascular nitric oxide production, which matters because insulin resistance and oxidative stress are major forces driving endothelial dysfunction. If blood sugar, blood pressure, sleep, and body composition are not addressed, no supplement can fully compensate for the vascular stress they create. For some men, a nitric oxide support protocol may be a reasonable adjunct, especially when the goal is to support endothelial biology rather than simply force a temporary response. Small studies have suggested that oral L-Citrulline, sometimes combined with other ingredients such as transresveratrol, can improve erectile function, including in men already using PDE5 inhibitors. Other combination trials using amino acids such as L-Arginine alongside tadalafil have also shown benefit. The honest interpretation is not that supplements are magic. The honest interpretation is that they may help support the nitric oxide pathway in selected men when the foundation is also being repaired. That is where a formula like Red Boost belongs in the conversation. Not as a miracle, not as a replacement for medical care, and not as a shortcut around cardiovascular risk, but as a potential lifestyle adjunct within a broader endothelial support blueprint. The idea is to help nourish the nitric oxide pathway and support healthy blood flow from the inside out while the real work continues on diet, movement, sleep, stress management, and metabolic recovery. If you are already taking prescription medication, or if you have diabetes, chest pain, shortness of breath, or known cardiovascular disease, this is exactly the point where you involve your physician or cardiologist. So here is the message I want you to remember. ED is not just a bedroom problem. In many men, it is a vascular problem with a warning label attached. The goal is not to shame the symptom, over-rely on the blue pill, or ignore the body's signal. The goal is to respond early, protect the endothelium, improve nitric oxide biology, and reduce cardiovascular risk before the problem becomes more serious. Always consult your physician or cardiologist before starting any new supplement protocol or changing prescribed medications. This video is for educational purposes only. ED can be an early sign of severe cardiovascular disease or diabetes.